Good afternoon, everyone from many parts of the globe. It is a beautiful sunny day in Montreal, I must say, although 8 degrees, not too warm, not like yesterday in Tel Aviv, where it was almost 35 degrees, I believe. Most of you know that I am Mark Mendelson, the Chief Executive Officer of our now named organization, Ben-Gurion University Canada. This used to be called Canadian Associates of Ben-Gurion University of the Negev, but after a few months of meeting, of a marketing group, we have now renamed and refreshed our name, Ben-Gurion University Canada. Very short and to the point. It's my pleasure to welcome you to another Webinar Wednesdays, even though it is taking place on Monday. Our previous almost 30 webinars, along with our Israeli literary series, have attracted quite a few thousand participants, and we look forward to continuing with these webinars, but at a slower pace than we did during COVID, probably once every month and a half. Also, the Ben-Gurion Gala Dinner for Sustainability and Climate Change, the first gala event in Vancouver in almost 2 decades, will be held June 9th in Vancouver's beautiful hotel, Fairmount Pacific Rim. The gala will honor RBC, British Columbia Regional President Martin Thibodeau, and will also bring in Professor Daniel Shamovitz, President of Ben-Gurion University. BGU Canada in Montreal will be holding its main event. Our Next 50, it's called. On June 14th, it will feature cantor Guidon Zellermeyer. Everyone who is from Montreal must know, probably the man with the most beautiful cantorial voice in Canada, if not North America. And he will be performing along with members of the Montreal Operatic Society. Money raised at both events will go directly to the School of Sustainability and Climate Change at Ben-Gurion University. Also happening June 14th in Winnipeg, an evening to commemorate the 50th anniversary of the 1972 Munich Olympics massacre that took the lives of 11 Israeli athletes. This is a movie being directed and produced by Canadian woman Francine Zuckerman, and it really features the aftermath of this huge tragedy, this terrible tragedy, and how it affected the women in the lives of these athletes. Tickets are now on sale, and they are going very fast. It could be that the mayor of Jerusalem might be present to bring greetings. We're just waiting for confirmation. Also in Toronto, the Future Is Now Gala, featuring the one and only Michael J. Fox live, will take place on Sunday, November 6th. All sponsorships at every level include a cocktail dinner pre-reception with an interactive experience involving BGU researchers from the Medical Simulation Building and a post-event dessert reception. To learn more about all the events, please go to our website, www.bengurion.ca, which will soon have a completely new look. Today's webinar, Detecting Autism in the Womb, Is It Possible?, should certainly be fascinating, as it is based on the groundbreaking research study authored by Professors Idan Menashe, Ilan Dinstein, and Dr. Gal Meiri, all part of the outstanding team of Ben-Gurion University's newly named Azrieli National Center for Autism and Neurodevelopment Research. Thanks to a transformational donation recently made by the Azrieli Foundation to Ben-Gurion University, and they have become very strong friends and supporters of our outstanding research. Can you believe that ultrasound could possibly detect anomalies in the development of the fetus, and whether the unborn baby might be on the autism spectrum? It is unbelievable. So we have with us Professor Idan Menashe, one of the main authors of this study, who I met personally about 4 to 5 years ago when I brought Idan and the rest of the BGU National Autism Research Team to visit Naomi Azrieli and her team at the Azrieli Foundation in Toronto. We had a fascinating 2-hour meeting with them, and I believe they realized then that what Ben-Gurion is doing in terms of autism research is out of the box, and they must support it. The format today will be like our other webinars. Idan will speak for about up to 30 minutes, at which point Galit Solomon, our our excellent director of marketing communications, will handle the Q&A. Professor Menashe Idan received a BSc in Medical Lab Sciences at BGU before he moved to the Weizmann Institute, where he received both his MSc and PhD in genetics and bioinformatics. During his doctoral studies, he was awarded with the extremely prestigious Levi Eshkol Fellowship from the Israeli Ministry of Science. Idan went to the National Cancer Institute as a postdoctoral fellow, where he was also awarded more rewards and awards for his outstanding research. He is an associate professor at the Public Health Department at BGU and leads a unique interdisciplinary group that study the genetic epidemiology of autism with a focus on genetic and non-genetic environmental risk factors of autism, identification of early biomarkers for autism, and understanding factors contributing to health disparities in autism diagnosis and treatment. Quite the mouthful. Idan serves as the scientific director of the Israeli National Center for Autism and Neurodevelopment Research and as the Israeli representative at the Global Senior Committee of the International Society for Autism Research. To date, Professor Menashe Idan has published well over 70 articles in high-impact journals. Idan, Professor Menashe, the screen is all yours.
Thank you, Mark, for this wonderful introduction. And hello, everyone, and almost happy Passover. So let me just share my screen. Let me just check that. Okay. Okay. So as Mark told you, I'm going to present to you today a recent study that we published, actually two studies on the same theme, that was where we asked whether we can detect autism in the womb using ultrasound technology. So everyone knows probably that autism spectrum disorder is a lifelong neurodevelopmental condition that affects almost 2% of the children worldwide. But unfortunately, at present, autism has no cure, and its etiology is very vaguely understood. Today, the diagnosis of autism is based on the clinical assessment of its core symptoms, which is deficits in social communication and the presentation of repetitive behavior. Because of that, the typical age of autism diagnosis is somewhere between 3 and 4 years, when these core symptoms are clearly noticeable. Despite that, we all know, and a lot of studies shows that early diagnosis of autism is very important because this leads to early intervention that has been proved to be highly effective in young ages. Despite these ages of autism diagnosis, this way of autism diagnosis, there are many studies that showing evidence suggesting that initial signs of autism may emerge even before the core behavioral symptoms are noticeable. A couple of these studies that were conducted in Israel, one from our lab, indicated that children with autism usually fail more frequently or fail more developmental milestones than other children even before the age of 1 year. Another study from Johnson and Klein from 2013 showed that, that attention to the eyes, which is one of the hallmarks of autism, is existing actually in young children, in babies with autism. And this started to decline at the age of 6 months, where in typical developing children, it is remain constant. So this means that at around six months of age, one can, one can test this eye contact of these children, it may be detecting some children that are at risk for developing of autism. Another couple of studies showed that some children with autism are born with smaller heads. A study conducted by Kurshan et al. In 2003, and another studies conducted by Professor Edna Gleason from our group show that some children are born with smaller and narrower heads. Some children with autism are born with smaller heads, but then after a couple of months, they catch up and their heads become at normal size. Additional morphological and anatomical anomalies are present in children with autism, especially those that are having some genetic syndromes. For example, many children with autism and genetic syndromes that are associated with the autism have some facial anomalies. Other children with other syndromes having some anomalies in the kidneys, in the heart, and so on. And all these symptoms or anomalies are congenital anomalies. These children are born with these anomalies, suggesting that they may started to be developed in the womb. So all these data suggest that in some cases, some children or some cases of ASD start to develop within in the womb, in beginning uterus, so ASD development beginning uterus. And fortunately, we have an excellent tool to study that. We have the ultrasound, which is an excellent tool to detect abnormal development of fetuses in the womb. And it's actually frequently used during prenatal screening. And actually, Israel is the world champion in prenatal screening of, in prenatal ultrasound screening, where every woman in Israel undergo at least 4 ultrasound exams during her pregnancy. And all these ultrasound scans are funded by the National Health Insurance. Usually, the first ultrasound scan, prenatal ultrasound scan, is done during the first trimester, around 11 weeks of gestation. And in this ultrasound scan, the doctor is usually assess the fetal viability, the number of fetuses, and try to assess the gestational age. The second ultrasound scan is called nuchal translucency scan, and in this is conducted around 14 weeks. And in this scan, the doctor is trying to detect early signs of chromosomal abnormality, usually Down syndrome. Next, and maybe the most important scan, fetal ultrasound scan, is called the fetal anatomical survey. There is an early fetal anatomical survey and late anatomical survey. Usually, women go to one of these. Usually the late anatomical survey, because it's easier to look at fetal anomalies later in gestation. And this is actually in Israel. This is actually the scan or the saver that is funded by the Ministry of Health. So in this scan, the doctor is scanning all the organs of the fetus, trying to identify some abnormal development of these organs. They also try to identify some maybe not abnormal, but slightly abnormal, the organ size, number, and the structure of the organs. And some of these signs are called soft markers because they are not really abnormality. They might be developing to normal organs. And the last ultrasound scans are done usually during mid-gestation or during the end of the pregnancy. And these are called biometric scans. These scans are conducted in order to try to assess the fetal growth the fetal weight. And in these ultrasound scan, the doctor is measuring, taking different biometric measures of fetal organ, usually the head circumference, the head width, the femur length, and the abdomen circumference. So we wanted to take advantage of the huge amount of data that exists in Israel, ultrasound data that exists in Israeli medical records, and ask whether we can detect whether there is some abnormal development of fetuses later developing into autism, and whether we can detect this abnormality in these ultrasound data. Importantly, this study was conducted under the umbrella of the newly Israeli National Center for Autism and Neurodevelopmental Research. And now I'll show you a movie of the different studies that are conducted in the center, and then we will go back and focus on this specific study.
In 2018, the Israeli Ministry of Science and Technology announced a grant to create a national autism research center. The grant was awarded to scientists from Ben-Gurion University.
Oops, sorry.
In 2018, the Israeli Ministry of Science and Technology announced a grant to create a national autism research center. The grant was awarded to scientists from Ben-Gurion University and physicians from Soroka Medical Center, who had developed a unique model that integrated scientific research into the clinics where autism is diagnosed and treated. Every year, 1,800 new children are diagnosed with autism in Israel, in 40 medical centers. Approximately 180 of these diagnoses take place in Soroka Medical Center. The diagnosis of autism requires multiple visits, in which clinicians interview the parents and directly assess the behavior of the child. By integrating the research into the diagnosis visits and later follow-up visits, scientists at BGU are able to collect a wide variety of data from a large number of children. This data includes detailed information about the child and family from the Soroka Electronic Patient Record System, behavioral information from voice and video recordings of the child during interactions with the clinical staff, parental questionnaires about sensory sensitivities and sleep habits, saliva samples for genetic testing, blood samples for metabolic testing, eye tracking while watching TV, and even EEG recordings during sleep. As of May 2020, the national database contained information from over 1,000 children with autism and their family members. This research is unique and extremely rare on a global scale, because it combines a wide variety of data from each of the children that is captured at the earliest stages of their development, when autism symptoms are first emerging. Today, scientists around the world agree that autism is not one disorder, but rather a family of distinct disorders that are likely to have different causes. By combining multiple types of data, the interdisciplinary team at the Negev Autism Center hopes to identify these distinct subgroups of children and match each subgroup with the most efficacious targeted treatments. The National Center is expanding these activities to additional medical centers throughout Israel. This expansion enables researchers across the country to identify the most effective diagnosis and treatment methods for autism, to develop new diagnosis technologies and medical interventions, and provide reliable and scientifically based advice to government officials. In parallel, the center is building a national research community that includes physicians, scientists, therapists, parents, and adults with autism. Hundreds of community members come to the annual Israeli meeting for autism research that is held at BGU. These efforts are transforming Israel into an international leader in clinical research that is focused on improving the quality of life for individuals with autism and their families.
So as you saw, that we are collecting a huge amount of data and very interdisciplinary data from all children that are enrolled in our center. This is a summary of the type of data that we are collecting and stored in our central database. And the data is in this database is actually a goldmine for autism research and used for the study I'm going to show you today. So for the study I'm going to show you today, we use data, clinical data, retrospective clinical data from electronic records, from ultrasound scans of members of Clalit Healthcare. Fortunately, about 70% of the children enrolled in our database are members of Clalit Healthcare Services, which is the largest HMO in Israel. What we did for this database, we went to the clinics, to the ultrasound clinics. My students went to the ultrasound clinics and extracted with a list of children diagnosed with autism from our center and looked in the Clalit Health records for the ultrasound scans, for the prenatal ultrasound scans of these children. When they found such ultrasound scan, then they looked also the ultrasound scans of their typically developing siblings, and also created a matched group, a matched control group of typically developing children from the general population that were matched to the ASD group by sex, by ethnicity, and by age. When we created these three data sets of ultrasound, then we started to compare the different findings from these ultrasound scans. In the first study, what we were interested at is to ask whether the observed abnormal development of the head that I already showed you, whether it's already starting in uterus, and whether we can see it in the biometric measures that are conducted in the second and third trimester. In this study, we compared the biometric measure scans of 174 ultrasound scans of autism and similar numbers of their siblings and the typically developing population control. What we found in this study were several interesting things. The first thing is we saw that there are significant sex differences in the fetal biometric measures. This was the first time someone is reporting sex differences in biometric measures of fetuses. These sex were as you can see here, the blue lines are the males and then the red lines are females. And you can see that male fetuses are usually larger than or having larger biometric measures than the female biometric measures. These sex differences are specifically important when you study autism because of the sex bias in autism, where we have 4 times more males autism than females. The second thing that we saw is that it was in the measures of the head. Here you can see, the measure of the head circumference and the measure of the BPD, which is the head width. You can see that these are the measures of the autism, and these are the dotted lines are the measure of the 2 controls group. You can see that in the second trimester, the head circumference and the head width is significantly smaller than the measure in the control group, both in males and in females. But what you can also see that the smaller head size that is seen in autism, in the autistic children, is also smaller in their sibling, suggesting that such smaller or abnormal head growth is a familiar trait or maybe a genetic trait. What you can also see here, that if you we followed we took both measures from the second trimester and the third trimester, and you can see that in the third trimester, the siblings of the autistic children were able to catch up with their measure, with the typically developing population control measure, while the children with autism remain, the head of the children with autism remains smaller. This catching up of the sibling is similar to the observation we saw after birth, where children with autism are born with smaller heads and then catching up in the first 6 months, catching up with the normal population to have normal head size. Another thing that we noticed that the differences in the head were specific to the head size. We didn't see such differences in the femur length and the abdomen circumference, suggesting that these differences are not related to the maybe to global or general smaller size of autism fetuses. Another thing that we noticed or asked is whether these head growth abnormalities are associated with the severity of the autism symptoms. And what we found was that we saw correlation between the size of the head and in the uterus and the severity of the symptom. The smaller the head, the more severe symptoms these fetuses presented after birth. So to summarize these findings of this part of the study, we found that male fetuses are larger, having larger biometric measure than female fetuses in general. We saw that children with autism or fetuses later developing into children with autism have a smaller and narrower head than the control group. We also saw that their sibling during the second trimester having the same head abnormalities, suggesting that these head or abnormal head development is probably a familial trait. And finally, we saw that the prenatal abnormal head growth is associated with more severe ASD symptom after birth. This study was published 2 years ago in the Journal of the American Academy of Child and Adolescent Psychiatry. In the second study, we asked whether we can use data from the fetal anatomical survey to see whether we can identify or whether children with autism or fetuses later developing children with autism have specific fetal anomalies. I want to remind you what we can detect in this fetal anatomical survey. So during the fetal anatomical survey, the doctor go over all the fetus organs and look for anomalies in the organs, in the organ size, in the shape of the organs, and even in the count of the organs. The detected anomalies are usually divided into two major types: or major structural anomalies that are obvious anatomical abnormalities, and also the doctors can detect what is called soft markers that are more subtle anomaly that are maybe considered normal variants or transient. The discovery of either the structural anomaly or the soft marker during the fetal anomaly survey will usually prompt a thorough examination of the fetal anomaly and consideration of further diagnostic testing, usually genetic testing, for chromosomal abnormalities. So we wanted to use these data from the fetal anatomical survey and you do the same comparison. Compare the data, the findings for these anatomical survey from the ASD group, from the autism group, to their typically developing siblings and the typically developing controls from the general population, you may notice that we already also increased the sample size of all these groups for this study. So what did we find in this study? First of all, we found that about 30% of fetuses later developing autism having some fetal anomalies or detectable fetal anomalies during these fetal anatomic scans. This number, 30%, is significantly larger than the findings found in their siblings, twice the number that were found in their siblings, typically developing siblings, and 3 times more than is found in other children in the general population. What we also found is that children with autism having significantly higher rates of multi-organ anomalies, as you can see here. These are the children that having more than one fetal anomaly. The black bars are autism, the gray bars are siblings, and the white bars are the normal population. So next we asked, in what organ can we see these differences, whether there are specific organs or whether there are randomly distributed in the organs. So in this graph, you can see that most of the differences or most of the fetal anatomical anomalies detected in children with autism were found, most of the differences were found in the urinary system, the kidneys mostly, in the heart, and also in the head and the brain. So most of the differences were found in these 3 organs. In addition, we also looked on the association of these fetal anomalies, the number of fetal anomalies, and whether a child has a fetal anomaly versus whether a child have no fetal anomalies during these scans, and their correlation with the severities. And like before, we found that there is a correlation or association between fetal anomalies and the severity of ASD symptoms. Here too, we found some sex differences in the number of fetal anomalies. Usually, the most significant differences in fetal anomalies between the groups were found in females versus males. This study was published recently in a very prestigious journal called Brain. And in summary, the main finding was that we found actually that ASD development, or the findings we found indicated that ASD development may begin in uterus, and at least in some cases, and involve multiple organs. Different fetal anomalies are associated with autism, and maybe the most important thing is that the clinical implication of our findings. If we see that specific fetal anomalies are associated with autism, it may suggest that one can use these fetal anomalies as early biomarkers for autism, and say that if a fetus, or if during the prenatal ultrasound scan, during the second trimester, someone see one of these fetal anomalies, either in the kidney, in the heart, or in the head and brain, they must suggest a higher risk for autism, and this should be followed very carefully, either in the womb with further genetic testing, or maybe after birth, looking for additional signs of autism development. These two studies got a very wide coverage in the media, as you can see, various prestigious places like the New York Post, CBS, also some Israeli main web pages. But we don't stop here. The next thing we want to ask is to use, or what we want to do is to use the additional data that exists in our database and ask whether we can combine this database, this data, and detect maybe specific genes that are leading to these fetal anomalies and specific as these autism subtypes. We also want to combine these ultrasound data with postnatal anatomical data or comorbidity data and ask whether these some of these fetal anomalies lead to some congenital malformation or congenital diseases like congenital heart diseases. And these data, combining these data would help us to maybe identify some specific subtypes of autism that are characterized by, first of all, fetal ultrasonography anomalies, specific genes, and later postnatal congenital diseases. Actually, we have some preliminary data from these assessment. We integrated the genetic data we have in our databases and our national database and the ultrasound data, and we found that children that had ultrasonographic markers during gestation are more susceptible to genetic variation in known genetic genes. So this shows you that there is some association between specific genetic mutations of autism and specific ultrasonographic anomalies identified in the brain. And the next step would be to ask what are these specific genes, whether specific genes are leading to specific heart abnormalities in the womb, whether other genes are leading to head and brain anomalies, and so on. This study was conducted mainly by my PhD student, Ohad Regev. He's an MD and PhD student, and in collaboration with Professor Reli Herskovich, which is the head of the obstetric and gynecology division at Soroka Hospital. And obviously, with the help of the entire national center team, you can see here all of them. Thank you very much, and I'll be happy to answer some questions.
Just coming back on screen. Hi there. Thank you so much, Professor Menashe. It's really fascinating. And Mark's on the screen with us. I'm sure he's got a couple of words he'd like to say as well.
Not till after. I don't know why I'm on the screen.
Oh, okay. Oh,
Should be.
we'll see you
it should
soon
be
then, Mark.
all
Thanks.
yours and Andy Dunn's.
Wonderful, thanks. Yeah, so we've got a few questions that are lined up. I'd like to begin by talking about some of the benefits of identifying autism in the womb and what it means for treatment moving forward. So perhaps we can begin there.
So as I said, there is a lot of data showing that almost every treatment for autism is more effective in young ages. So the earlier you start the intervention, the better or the more effective it is. Some people also suggest to start intervention even if initial suspicion for autism begin, even before the official diagnosis. And this might bring the child or result with better prognosis of the child even before it was diagnosed.
And you did mention as well that in your study you found that your ability to identify these markers in girls was more common than in boys. Is there, like, can you may have already alluded to this, but it's always worth going back and reiterating, what is the reason for that?
We actually don't know. We don't know what's the reason why we found larger differences in girls than in boys. We may hypothesize that this is maybe related to the reason where that autism, usually when it's detected in girls, it's the more severe types of autism. And I showed you that these abnormalities that we found were correlated with the severity of autism. So this might be the reason, but we actually don't know.
Is that something that you could perhaps explore or interested in exploring, or are there other areas that are more important at this time to explore as you move
Yeah,
forward?
we want to explore. One of the main questions in the autism research is what is the differences in the sex differences in autism, and this might be related to it. There are a lot of hypotheses why there are differences in the prevalence of autism between males and females, and why there are differences in the severity. There are a lot of theories. Some are supported, some are not, but nobody knows the ultimate answer to that. And this might also add to the evidence that may help solving this question.
We'll take a question now from the audience now from Doris Wexler Charo, who asks, does the age of the mother make a difference? And has there been a correlation made there at all?
So yes and no. So we know that the parental age, both the father and the mother age, is a risk factor for autism. The older the parents, the higher the risk for the children with the autism. In this study, we didn't see any differences between the groups. So our groups, the autism group and the two control groups, the mother had on average the same age. So we couldn't actually test the correlation with the mother age and the finding we found.
A question from an anonymous attendee who asks, is it a decrease in eye contact that occurs beginning at the age of 6 months? Just to clarify, because you had alluded that you can see some markers that young in a baby.
Yes, so as there's a lot of studies about the eye contact, which is as I mentioned, is the hallmark of autism. And what Jones and Klein showed in their beautiful study in 2013 is that this eye contact is normal in children later developing autism until age 6 months, and then it started to decline.
And another anonymous question here, is detection of wider neck measurement at second ultrasound an indication of autism Asperger's?
A wider neck, I'm not sure whether they look on the neck or measure the neck during the anatomical survey. They might. We didn't see any indication that it might be associated with autism. The neck or the width of the neck is used during the nuchal translucency measure, and it is a marker for risk for Down syndrome, as I mentioned.
Okay. Daniel Goldowitz asks, apologies if I missed it, but what are the intersection of the findings of Prechter, I'm not sure if I'm pronouncing it right, and more recent studies on ultrasound studies and the detection of neurodevelopment disorders?
So can you repeat the question?
Sure. Daniel asks, what are the intersection of the findings of Prechter? I'm assuming it's a study that was out there. Perhaps Daniel, if you don't mind providing us with some more information, just in case Professor Menashe needs a refresher there. So the question, what are the intersection of the findings of Prechter and more recent studies on ultrasound studies and the detection of neurodevelopment disorders?
So I'm not sure what type of study he alluded to. There are studies that suggested that maybe these are the studies that he mentioned, that exposure to ultrasound may increase the risk for autism. Other studies indicated that there is no risk in exposure to autism. Israel is a good place to study it because, as I said, it's the world champion in the number of ultrasound exposure during pregnancy, and we don't see higher rates of autism in Israel compared to other places. We know that other studies, there were very few studies that looked on ultrasound or fetal anomalies using ultrasound scans in children with autism. These were very small studies, And most of them supported the finding that we found. The one very, very big limitation that all other studies had and we didn't is that they didn't look on the sex of the fetus. And they didn't account for the sex. And as I showed you, in both our study, there were major differences between males and females in the number of anatomical anomalies and also in the size of the fetus. So if you don't account for it, you might find some results that are not true.
Keith Maloff asks, I'm curious to learn your protocols for evaluating the onset and offset of primitive reflexes in all neonates. For instance, sucking, rooting, truck incurvation, parachute, startle, the time of appearance of the formation of a perfect kiss, speech and language, milestones, etc., as part of the process of early identification of infantile autism.
I totally agree. This is fascinating. In our study, we couldn't. So these kind of markers or reflexes can be detected maybe in ultrasound video movies. We didn't have this data. This is certainly something we are looking for and would like to test. But I'm also think that there's much more data that we already found in these ultrasound scans that may help us to identify maybe additional markers for autism and make this tool like a screening tool for autism in the womb.
A question to do with ethics now. What would be clinical consequences of an ultrasound detection? Would you also see ethical dilemmas?
Obviously, there are ethical dilemmas, but there are ethical dilemmas in every prenatal scan. So we use ultrasound not only for, we don't use it for autism, we use it for other things. And all these markers that are detected assume that the mother, during the nuchal translucency, the doctor said there is a higher risk for Down syndrome. What are you doing? There's an ethical dilemma here. So the same ethical dilemma that exists in other diseases that can be detected in the womb would apply for autism.
Another anonymous question for you now. You noted that 30% of the ASD sample had the fetal anomalies. What were the rates found in females versus males?
Well, I can't find it in from a memory, but I think it was 1.5 more prevalent in females versus male. I can't remember the exact numbers.
Okay. We have a question now from Harry Baum, who asks, a 4-month-old male diagnosed with severe autism, what genetic markers can be checked if they are wishing to have a sibling for this child?
So this brings us to a whole new different area of autism genetics, which is also something I'm studying in our center. So today we started to understand better and better the genetic reasons for autism. We know that autism is, or most of there's a very major part of genetics in autism risk. Unfortunately, until recently, we didn't really were able to find the actual genes or the genetic variation that cause autism. This is changing right now. The revolution or the genomic revolution of the last year helped us to identify more and more genes that are associated with autism. And today we are able to detect genetic or genetic causes of autism in around 15 to 20% of these children. We have a very big study in Israel also that we are looking right now at that, and we are developing tools for genetic diagnosis of autism. And once, if you are one of these 20% of these children, and you know the reason or the genetic reason for autism in your family, you can do some family planning. Importantly, I want to add something more, that in many cases, the genetic cause of autism is not inherited. Is a new mutation in the child that is not that was not inherited from his parents. So in that cases, you are more you can be more confident that the other children that you will have would not have autism, because this genetic mutation is unique to this specific child.
Got it. Okay. I'm sure that you feel with this research that you're just scratching the surface of something that can continue in terms of research, going back to the lab, going back to your database and so on. Let's look ahead for a moment. And where do you want to go with this study? What's next? I know you made some reference towards the end of your presentation about what's next, but let's expand on that. How far can this research take us?
So I think on two major directions. One is towards research, trying to understand the reason for this association between like different fetal anomalies, why the kidney is associated with autism, why abnormalities in the kidneys are associated with autism, why abnormalities in the heart are associated with autism. Trying to understand the mechanism, the underlying mechanism of autism together with heart defects or kidney defects and so on. When we will understand, this will help us to better understand the mechanism, the underlying mechanism that's leading to autism development. And once we understand the underlying mechanism, we can develop better therapies that are specific to this mechanism. This is one thing. Another direction is trying to build a screening tool for autism partially based on these ultrasound findings, maybe add to it some additional data from other disciplines. And these tool or this screening tool will help us to detect autism much early before the age of 3 and 4 years. And as I mentioned, early detection of autism will help us to give better intervention for these children.
This next question comes to us from Rhoda Smith, and it kind of, I guess, comes out of the previous question that you were asked, but she asks, is there a genetic factor in families who have more than one child with ASD?
So obviously you can imagine that if you have more than one child with autism, it's something familiar. It indicated that there is something, that this is familiar. Usually when we are talking about familiar trait, we are talking about genetic trait. It's not always true, but in most of the things true. And genetic trait that is inherited from the mother and the father. Then now we can ask, if it's inherited from the mother and the father, then why we don't see autism in either of them. So sometimes we see some indication for autism symptoms, some sign of autism in either the mother or the father. But like many other genetic disorders, it can happen that both mother and father are carrier of specific mutation, and only the combination of the two gametes from the father and the mother, when they are combined together in the same child, they bring the autism is presented.
Of course, BGU is known for being a university that thinks outside the box. A lot of the research that's done there is thinking about outside the box. And so our next question comes from one of our attendees, and I'll wrap up with this one. The question is, are you open to engaging in collaborative research with scientists in Canada? What would be the best way to pursue that? Can researchers in Canada participate in your conference? And is there a way to present a paper?
So the short answer, obviously, and the longer answer, yes. We already do some collaboration with scientists from Winnipeg, from British Columbia University, and we are open. We had talked with people from Montreal, from Toronto. We are actually encouraging international collaboration for our center from Canada and other places in the world. We are open for this collaboration, and we are happy to have visitors and try to conduct mutual research. Because I think that combining research between institutes and combining data, the same data from different institutes, actually strengthening the result we are finding.
And there was a reference there too to the conference, which you held not too long ago. How did the conference go? And maybe you can give us a brief summary as Mark rejoins us on screen.
Yes, so the conference actually was wonderful. It was partially it was wonderful because people wanted to finally meet in person rather on Zoom. We were actually surprised for how successful it was. We were able to bring some top of the autism research from the world, from Cesar Hape from London, Diana Robbins from Philadelphia. There were a lot of new studies that were presented in this conference. I think more than 500 people attended the 3 days, and it was beautiful. It was excellent conference.
Wonderful. Professor Menashe, thank you. Appreciate it.
You know, Idan, I had a ticket to come to Israel for the conference.
And why didn't you come?
And then for some reason, I thought that it was not going on. I never got,
Really?
yeah. Anyways, we shall have to
Well,
correct that.
we weren't sure until a week before, but we decided no matter, because this was the almost the peak of the Omicron.
Yes, I
wave.
remember. And 500 people attending is fabulous.
Yes, and we decided we are not canceling it anymore. We are, if the Ministry of Health letting us do this conference, we are doing it.
Good for you. Anyways, Idan, what can I say? I mean, every time I listen to you or Ilan or Gal or whoever, one of your team, I the out of the box science and research that you guys are conducting there is just, I really predict I hope I'll be around in 10, 15 years that the Nobel Prize Committee will come knocking at your door. And I will say, I brought them to Azrieli.
Finger crossed.
Anyways, absolutely brilliant. Thank you so much. And it really is a theme, this brilliance of out-of-the-box research, which permeates most of the research being done at Ben-Gurion University. We might be the youngest university in Israel, but we are definitely the best. Huge thanks to Galit Solomon, as well as our behind-the-scenes executive directors, otherwise known as the techies of BGU Canada, Simon Ben-Simon, Shimi Wenner, David Burson, and Zach Ostrov, and of course, the other members of our behind-the-scenes admin staff, which altogether formulate the best of any Israel-based organization in Canada. And this year, by the way, to everyone who was on, we established our 5th record-breaking income and fundraising levels in 5 years, and we expect to continue the next few years. Join us and see how fascinating we have become. And may I take this opportunity to wish you all a Chag Pesach Sameach and a safe COVID-free spring. The Omicron, or what is it called, BA2 or B2A, or is raising its ugly head, and I just hope that people will be smart enough to continue to wear masks. And for the first time since 2019, a live Board of Governors meeting will take place in Israel in just over a month, and I'm so looking forward to be present, and I will see you at the meeting. Done? I'm very proud to say that there are 4 Canadians receiving honorary doctorates from BGU this year. So we also, we certainly hit above our fighting weight. Mazal tov to all, and stay COVID safe. By the way, I have already received my 4th vaccine. I encourage everyone in Canada or in the States to do so as well. Keep well, take care, and kiss your family, your loved ones. Mark out.
Thank you very much.